bring up our next guest when my team is ready for our next guest. And we're going to move to another field of dentistry that Dr. Mopper probably never thought was even going to be invented when he was a young dentist. We have Dr. Bryan from Transcend. Bryan, tell us about what Transcend does and what you guys are doing with CE, and also what you do there.
Yeah, so we're located in Huntsville, Alabama, and our mission here is to be able to provide pretty much all things digital, right? So we want to be able to help people implement digital workflows within their office. And we get that a lot of times it can be confusing, overwhelming with the products that are out there and the workflows to be able to actually implement it so it saves you time and money. And so our focus is to help doctors be able to do that. I've teamed up with Dr. Corey Glenn and Dr. Ben Kellum. And Dr. Glenn is known as kind of the guided surgery guru.
Yeah.
He's been making surgical guides for a long time, and has really pioneered a lot in that space. And then Dr. Kellum with implants and with design and milling. So we've married a lot of the lab stuff with in-house general dentistry.
I like that. This is probably appropriate, Bryan, for me to talk to you about my failed dream of playing in the NBA. But what I am going to do is ask you guys to create a basketball team, and we will create one at Nachos. But we have Marcus Cowan. So when you look up Marcus Cowan, that is an unfair advantage for us. But building a teaching team is so key. Corey is amazing. He's come to speak with us at Nachos a few years ago. He got Nachos at my favorite place. And he really is someone on the frontier constantly pushing digital dentistry forward. How many years have you been a dentist for? When did you graduate from school?
So I graduated in 2016. And straight off the bat, I got into digital dentistry, the gateway drug of CEREC. So that's really where I've started and lived in that world for the past few years. But I actually went back. I was in private practice for 4 years and went back and did a residency because I wanted to expand my implant training.
Where did you do your residency?
I was at the Foundry in Birmingham, Alabama.
Yeah, that's an awesome program. Now, tell me, whether you've been a dentist for 5 years, 45 years like Dr. Mopper, 19 years for me, it's challenging to put new things into your practice. Let's bring Bryan back up here. Sorry. Challenging to bring new things into your practice. What is the benefit? Someone's out there doing analog stuff. They're taking PVS impressions just like we are, and they're not even ready to jump into digital. What is like one or two things where you say, you'll be glad you did this? Is it time savings, coolness factor, patients love it? Tell me a little bit about that.
Yeah, I would say if you're not in the world of digital dentistry right now, the two things that I would probably recommend are getting an intraoral scanner, so you can digitize your impressions. You can send those off to labs, and they can make your crowns on it. It'll save you some money from that standpoint. But also it allows you to be able to show the patient their mouth. You think about an intraoral photograph, but this is a scan that you can rotate and show them what they actually have. The other thing I would probably recommend getting into is kind of the low barrier to entry would be 3D printing. Get a 3D printer. You can do so many different things with it, whether it's models. They're getting to the point where you can make functional crowns with that and ceramic resins. Or whether it's making night guards and things that are a little bit, more ubiquitous in your practice.
And I love that you guys have created a center just for this, just like Dr. Mopper's created a center on composite dentistry. Tell us about this Transcend CE Center. If someone's like, first time they watch in, they're going to text Transcend to 215-543-6454. We got an awesome Nacho discount for them. But what are some of the upcoming courses at the center that people would be interested in?
Yeah, that's a great question. So tomorrow, actually, we are doing our full mouth all on X sort of surgical guide course. So, we have a level 1 course that is single tooth implants and ones and twos here and there. And this is a step beyond that. So, doing full mouth cases and full arch cases. So those are two of our most popular courses that we offer, things that Corey's been doing for a long time. But we also have digital dentistry or digital dentures, and we did full mouth rehabs and then in-house crowns.
What is it? I mean, I've watched Corey's stuff, and genuinely we still just make dentures pretty much the classic way. You don't have to call it old-fashioned, but classic. What is the advantage of the digital denture world as you've seen through Corey? I'm interested personally in learning more about it. Our prosthodontist, he'll get mad if he hears me. He has made some digital dentures at the lab side, at least.
Right.
But tell me about dentures have always been something dentists have struggled with. How does doing digital dentures help?
Yeah, so a lot of the workflows are there's some similar portions or aspects of it, but then you jump into a digital design world. So one of the major advantages that I see is that if you have a patient that for example, breaks their denture, you already have that file saved, and you can print a new denture or mill a new denture in a couple of hours and get that to them without having to go through the whole process of rebuilding the denture. So, that's one of the quick things that you can do. Pretty easy to make adjustments and changes in the design and model. And then the expense is pretty low as far as you being able to have that control. And that's one of the things that I like as well, is having a say and sort of feedback, immediate feedback for what I'm making, and I can put it in the patient's mouth. If I want to change something, I can do that.
I just wanted to ask one question. I'll get into this, but I don't have to festoon anything, do I? Do I have to do any festooning?
Only digital. You don't have to.
I mean, honestly, that was one of the worst times. Could you festoon your denture now? It's like, I'd like to live in the middle of the woods.
It makes it look beautiful, but it does take some time. So
it's like when festooning was like when you put the mammalians on a crown, and people are like, "What's this dumb thing?" Right?
Yeah, like take that out. I don't like that. Yeah.
My life did this once for an implant crown. I had to send the whole thing back. I said, "Stop being so fancy."
Yeah, right.
Fancy. Awesome. Well, how can people reach out to you if they want to connect with you? I'm super excited if you guys be collaborating with us. We have your text code here.
Yeah.
If they want to check out the website or even just reach out to you personally, how can they do that?
Yeah, so transcendde.com is our website. We have a list of our courses that we're offering. I just want to say next year, we're in the process of demoing our building. We're going to be building a clinic where docs will be able to come and perform surgery live in our facility. So that's really what we're looking forward to next year. But otherwise, you can reach me at Kariya, that's Kariya at transcendde.com as well, or hit us up on our website. That's transcendde.com.
Awesome, Bryan. We really appreciate it. I want to meet you in person. We're glad we get to talk here online, and we'll have a really great collaboration.
Yeah, thank you. Been great.
Awesome. So as you guys see, we got someone 45 years in dentistry, somebody 5 years in dentistry. It's the whole point of talking nachos, for us to learn more, share more, build a better dentistry world together.